Hello, welcome back. The topic today is very important or very common topic. What food to eat and what not to eat for gastric ulcer or gastritis. Gastric ulcer, gastritis is a very common and very important clinical disease in the practice, and most of the people are worried about what to eat, what not to eat. So again, gastric ulcer is nothing but, suppose you have a wound here, we call it ulcer in the hand. The same thing, if you have a wound in the mouth, we call it mouth ulcer. Ulcer is a wound. So wound is in the stomach part. So what is the difference? Here is outside and there is no constant exposure to acid. But in the abdomen, there is always acid. Almost 24 hours there is acid pooling, and the acid always corrodes the ulcer. So this is you have to understand before what to eat, what not to eat. First and foremost, I always say most of the people, they know what to eat, what not to eat, but they forget the timing. The time is very, very, very important. So now the teaching they say is the moment you wake up from the bed. So during sleep, usually acid level is very, 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 very low. But the moment you wake up, the acid starts secreting and starts pooling in the stomach. So don't give too much of time after getting up. The teaching is have a breakfast within 30 minutes after getting up. It's not possible. At least try to have within 1 to 1.5 hours after getting up. At least a light, solid food you should take. So first is timing of food. And the second thing is, the best way to dilute the acid is always water. So keep sipping water every half an hour, every 1 hour, keep sipping water. The water dilutes the acid and it neutralizes it. Or all the more if you take ice cold water, that is much, much better. In fact, for the pain, burning thing, if you take ice water, you feel a little better also. So it dilutes as well as it relieves some amount of pain. And third thing we always say what to eat is the fiber-rich diet. So fiber-rich diet stays longer in the stomach, and the acid gets diluted or can be neutralized with a fiber-rich diet. And very importantly, we can say have some food which has more of probiotic. The best is yogurt or curd, these kind of things. They are even vegetables. All these things they have probiotic. They can improve the good bacteria. So the H. pylori, the common bacterium for the gastric ulcer, can be neutralized, can be tackled by this good bacteria. And the food timing, we always say, suppose you have a breakfast by morning 8 o'clock, then by mid-morning snacks like fruits, vegetable salad by 10:45 to 11 o'clock. 1 o'clock lunch, 4:30, some fiber-rich kind of snacks, something like that, and 7:30, 8 o'clock night dinner. And suppose going to bed by 10 o'clock, suppose still feel hungry, you can have fruits. So that the timing is very important. So most of the people, they know what to eat, but they forget about the timing. So timing is very, very, very important. Suppose you take every 2.5 hours. Here I didn't say about the juice part. Instead of juice, you can have fruits. The reason being, if you take a juice, it's absorbed within 5 minutes and it empties the stomach. So acid again comes out. So instead of that, you take plenty of fresh fruits, so that it stay longer in the stomach. So the acid gets neutralized easily. So first and foremost, I would say first is timing of food. Second, keep sipping water. That really helps diluting acid. Third, probiotics and fiber-rich diet. These are the things. And what not to eat. This is very, 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 very important. First and foremost, alcohol in any form should be avoided. Alcohol directly disrupts the epithelium and induces the ulcers. So avoid alcohol, and avoid unnecessary medications, especially painkillers. Without doctor's prescription or advice, don't ever take tablets, especially painkillers. They can affect this part. Next is tea, coffee and milk. Coming back to tea is nothing but tannic acid. Already acid is high or very rich, it erodes corrodes the ulcer. So tea can aggravate the problem. So avoid tea. Caffeine again, it's a strong gastric irritant. So again, avoid tea, coffee and milk. Milk, those days, ice cold milk was given as a treatment for peptic ulcer. But now it's entirely different. So ice milk and acid becomes they become curd-like thing and cause a lot of acid reflux, bloated things and all. So avoid tea, coffee, milk. And next is avoid citrus thing. Citrus is nothing but citric acid. So what are the citrus things? Commonest we are orange, grapes, lime, lemon, all these things, grapes. Then mango. The mango, most of the people doesn't know it's a citric thing. It's actually strong citrus fruit. So orange, grapes, mango, all these things should be, pineapple, these things should be avoided. So take home message, what to eat. First is timing. So timing is very important. Next, keep sipping water. Third, fiber rich diet. Fourth, probiotic rich food. Then what not to eat. First is alcohol and smoking, unnecessary drugs to be stopped, and citrus and tea, coffee, milk. These to be avoided if you have a gastric ulcer. And of course, get help from your doctor. He can advise you, look for what is the root cause for the ulcer, and accordingly he can treat you. Thank you.